What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. This video is brought to you by Picmonic. Click on the link in the description box to try Picmonic for free. Today's topic is vaginitis. What does itis mean? Inflammation. Inflammation of what? Of the vaginal canal. This could be caused by a foreign body. It could be caused by postmenopausal atrophic vaginitis. It could be caused after trauma, or it could be caused by Gardnerella vaginalis, and that's a bacteria, Trichomonas vaginalis, and that's a protozoa, or Candida albicans, and that's a fungus. So click the like button, click the subscribe button, and let's get started. So you'll find two playlists on my channel. One is called Microbiology, the other is called Picmonic. If you want to learn about actinomyces, listeria, corynebacteria, and nocardia, see part 1. To learn about all the Clostridia, see part 2. If you want to learn about Staph aureus, Staph epidermidis, Staph saprophyticus, and Streptococcus pneumoniae, watch part 3. For Strep viridans, Pyogenes, Egalactia, Enterococcus, and bovis, watch part 4. For Bacillus anthracis, Bacillus cereus, Mycobacterium tuberculosis, and Mycobacterium leprae, watch part 5. For the Neisseria and the Moraxella, watch part 6. For Haemophilus, Bordetella, Pasteurella, Brucella, Francisella, watch part 7. For Legionella and Helicobacter pylori, watch part 8. For Campylobacter, jejuni, Vibrio, Cholera, E. coli, and Klebsiella, watch part 9. For Pseudomonas, Proteus, Salmonella, part 10. For Shigella and Yersinia, part 11. In part 12, we talked about the spirochetes, Treponema pallidum, which causes syphilis, Leptospira interrogans, which causes leptospirosis, Borrelia burgdorferi, which causes Lyme disease. In part 13, we talked about atypical organisms. These are anatomically gram-negative. They were supposed to look pink when you stain them with gram stain, but when we went to the lab, they did not stain well with gram stain. These are chlamydia, rickettsia, and mycoplasma. And in part 14, we talked about the torch infections. Do you know what the T stands for? How about the O, the R, the C, the H, and the S? If you know the answer, please comment below. What is microbiology? Ology means the study of, bio means life, micro means small. So microbiology literally means the study of small life. Microbes are divided into bacteria, fungi, viruses, and parasites. And that's why microbiology studies bacteriology, fungology or mycology, virology, and parasitology. Let's talk about bacterial classification. By gram stain, if they appear purple, they are gram positive. If they appear pink, they are gram negative. Each one could be cocci or rods. Cocci means spherical, rods means elongated. For gram positive bacteria, the cocci could be catalase positive like staph or catalase negative like strep. As for the rods, they could be spore forming or non-spore forming. The non-spore forming gram-positive rods include aerobic ones and anaerobic ones. Aerobics are Listeria, Nocardia, and Corynebacteria. Anaerobic, Actinomyces. The gram-positive rods that happen to be spore-forming could be aerobic or anaerobic. The aerobic ones include Bacillus cereus, which causes food poisoning, and Bacillus anthracis, which causes anthrax. As for the anaerobics, you have the Clostridia, such as Clostridium tetani, botulinum, difficile, and perfringens. Clostridium tetani causes tetanus. Clostridium botulinum causes botulism. Clostridium difficile causes pseudomembranous colitis. Clostridium perfringens can lead to food poisoning, myonecrosis, and gas gangrene. Next, let's talk about gram-positive cocci. Catalase positive, staph. Catalase negative, strep. If you're catalase positive, the next question is, are you coagulase positive or coagulase negative? If you do have coagulase, you are Staph aureus. If you do not have coagulase, you could be Staph epidermidis or Staph saprophyticus. What if I'm catalase negative? You are a Streptococcus. Then the next question is, are you alpha hemolytic, meaning partial hemolysis? Are you beta hemolytic, meaning full or complete hemolysis? Or are you gamma hemolytic, meaning no hemolysis? If you are alpha hemolytic, you could be strep pneumo or viridans. If you are beta hemolytic, you could be group A strep, Pyogenes, or group B strep, Egalactiae. If you're gamma hemolytic, you could be Enterococcus or Streptococcus bovis. That's the old name. The new name is Streptococcus gallolyticus. Bovis was much easier, to be honest. We're done with the gram positives. Let's talk about the gram negatives. They're either cocci or rods. If they are cocci, they could be diplococci. What does diplo mean? It means double, so they look like this. Or they could be coccobacillus, so it's between the coccus and the rod, something like this. Neither coccus nor rod. Oh, that's weird. It's neither sphere nor an elongated cigar. Next, if they are gram-negative rods, they could be bacilli, which means a rod like this, or they could be a curved rod, just like that. The gram-negative diplococci could be maltose fermenters like Neisseria meningitidis or non-maltose fermenters like Neisseria gonorrhea and Moraxilla catarrhalis. Why do you call it catarrhalis? Because it causes a catarrhal inflammation. What is catarrh? It's acute inflammation of your mucous membrane, especially in the head and neck area. So, rhinitis, sinusitis, with all of the sputum, the pus, and that lovely stuff that comes out. That is catarrh. Next, gram-negative coccobacilli, Haemophilus influenza, Bordetella pertussis, Pastorella, Brucella francisella. Let me tell you something very important. If you are a student, not a PhD student, but just a medical student, nursing student, etc., if the bacteria ends in ella, it's gram-negative. Not in the encyclopedias, but for your exam. For your exam, if it ends in ella, it's gram-negative for the most part. But of course, if you are professional, you know that some bacteria end in ella and they are gram-positive. But if you're just a student, use this trick. Next, gram-negative rod, and it's not curved. Legionella pneumophila is a great example. What if it's curved? H. pylori. But it's not just Legionella that is gram-negative rod. We have also E. coli and Klebsiella. And the curved is not just H. pylori, but H. pylori, Campylobacter jejuni, and Vibrio cholera. Then, if you encounter a gram-negative rod, ask yourself, can it ferment lactose? If the answer is yes, it will appear pink on McConkey. So, the next question should be, are you a slow fermenter of lactose or a fast fermenter of lactose? But if you are lactose non-fermenter, it means you'll appear white on McConkey. The next question is, are you oxidase positive or oxidase negative? Pseudomonas is oxidase positive, but Salmonella, Shigella, Proteus, Yersinia are oxidase negative. For more elaborate charts like this that divide between cocci and bacilli, Picmonic has some really doozy charts. Just click on the link in the description box or in the first comment. Today's topic, vaginal disorders. Vaginal disorders are many. There are congenital disorders of the vaginal canal. There are vaginal discharges. Some are normal, some are not. There are miscellaneous conditions like vaginismus, vaginal dryness, dyspareunia, meaning painful intercourse, and others. Then we have vaginal infections, could be bacterial, could be fungal, could be protozoal, etc. And then we have vaginal tumors. The vaginal tumors could be benign, which means not cancer, or could be malignant, which is cancer. Vaginal discharge could be physiological or pathological. The physiological, normal one, does not burn and does not itch. But the pathological usually burns and usually itches. The normal, physiological vaginal discharge does not have any bad odors. However, the pathological ones, where there is a disease, usually smells bad. Usually there is redness and swelling and friable tissue in the mucosa. And there could be tenderness in the cervix, which means when the doctor touches the uterine cervix, it hurts. That's what tenderness means. Example of physiological vaginal discharge, physiological leukorrhea. How about the pathological? It could be sexually transmitted infection, could be vaginitis, could be endometritis, and others. Causes of vaginitis could be an infection, could be no infection. Infections could be bacterial, protozoal, or fungal. For bacterial infections, we'll give antibiotics, which means antibacterials. For protozoa, we give antiprotozoal. For fungal, we give antifungals. For all of these, it is paramount to improve personal hygiene. It makes all the difference in the world. Postmenopausal women can suffer from atrophic vaginitis, where there is atrophy in the vagina, so estrogen cream can help. Why is this? Because after menopause, the estrogen level drops. So the treatment will be to give estrogen cream. Alright, Picmonic, take it from here.
Recall vaginitis by the story of a big garden competition where someone has sabotaged Gina's Vagina Violet garden and set it on fire. Vaginitis is commonly caused by an infection, shown by the infectious bacteria, but it may also be due to postmenopausal atrophy, the postman pause with atrophy. Depending on the causative organism, vaginitis may cause vaginal discharge, shown by the vagina violet with discharge, and severe itching or pruritus, the prairie dog. Vaginitis caused by a fungal infection will be treated with antifungals, shown by the anti-fungi, while antibiotics, represented by the ABX guy, are used to treat bacterial causes. Vaginitis caused by postmenopausal atrophy may be treated with estrogen hormones, illustrated by the Easter egg harmonica. To prevent infecting others, advise the patient to abstain from sexual activity until the infection is resolved with a completed full course of medication. Abstinence is shown by the purity ring. Additionally, educate patients on the importance of good hygiene, shown by the clean hygienes. This includes keeping the genital area clean and dry, along with wearing cotton underwear. This is especially important to prevent recurrent vaginitis, displayed by the recurrent clock with vagina violets on fire. However, if the patient experiences multiple infections of Candida albicans, refer them to get tested for HIV, since recurrent infection is a common symptom of HIV. So let's review vaginitis. It is most commonly caused by an infection, or it can be due to postmenopausal atrophy. Patients often complain of vaginal discharge and pruritus. Medications prescribed to treat vaginitis include antifungals, antibiotics, and estrogen hormones. Advise the patient to practice abstinence until the infection is resolved and educate on the importance of good hygiene to prevent recurrent vaginitis, which may indicate a need to test for HIV.
The next topic that we'll talk about is bacterial vaginosis, which is not an STD. What's the cause? A bacteria known as Gardnerella vaginalis. Usually does not itch, however, it has grayish whitish discharge. How can we diagnose this? First, from the smell. It smells horrible. It smells like fish. And if you take a sample of those secretions, put it under the microscope, you will find vaginal epithelial cell. That's normal because the vagina has epithelium, but they are surrounded all over by teeny tiny bacteria like this, and this is Gardnerella vaginalis surrounding the epithelial cells. How can we treat this disease? Metronidazole or clindamycin. Here is a note for the pros. Metronidazole is not teratogenic, but methotrexate is. So please do not confuse metronidazole with methotrexate. Normally, there is good bacteria living in the vagina, known as lactobacilli. They keep the vaginal pH less than 4.5. This is the normal pH of the vaginal canal, and this is an acidic pH, which is good because acids can kill the harmful bacteria. Unfortunately, when the pH of the vagina increases above 4.5, the patient becomes susceptible to bacterial vaginosis. So in cases of bacterial vaginosis, we expect the vaginal pH to be above 4.5. Keep in mind that prolonged use of antibiotics can kill the normal lactobacilli, which can predispose the vaginal canal to infections.
Gardnerella vaginalis is depicted in this picmonic by Gardnerella. This species of bacteria causes bacterial vaginosis, portrayed by the bacteria guy with the vagina violet. It is important to note that this infection, although associated with sexual activity, is not an STD that can be spread from partner to partner. This is illustrated in this picture by the STD-free chastity belt. Characteristically, bacterial vaginosis causes a foul odor that is described as a fishy smell, represented by the fish head flowers. When potassium hydroxide solution is added to a sample of vaginal discharge caused by bacterial vaginosis, it also creates a strong fishy odor called a positive whiff test, represented by the whiff smell and foul face of Gardnerella. Patients often complain of gray-colored vaginal discharge, portrayed by the gray discharge from the vagina violet. Gardnerella vaginalis infections cause an increase in the pH of the vagina, illustrated by the up arrow pH scale. Bacterial vaginosis can be diagnosed under the microscope with visualization of clue cells, depicted by the clue cells with the question marks. Clue cells are squamous epithelial cells covered with bacteria, portrayed by the square mouse covered by bacteria. Gardnerella is often associated with a co-infection by the anaerobic organism called Mobiluncus, represented by the Moby whale co-infection. Bacterial vaginosis is treated by metronidazole, shown by the Metronite. So in summary, Gardnerella vaginalis is the causative organism of bacterial vaginosis. Remember that this is not considered an STD, though it is associated with sexual intercourse. Infection is associated with a fishy smell, positive whiff test, gray-colored vaginal discharge, and an increased vaginal pH. It can be diagnosed microscopically by the presence of clue cells, which are squamous epithelial cells covered with bacteria. This organism is often associated with Mobiluncus co-infection and is treated with metronidazole.
Next, we're going to talk about Trichomonas vaginalis. Now, this one is an STD. The organism that causes this is a protozoa known as Trichomonas vaginalis. The discharge is profuse, green, and frothy. This one is green, not grayish-whitish. It is foul-smelling discharge with dysuria, meaning difficulty urinating or pain on urination, and dyspareunia, meaning painful intercourse. Under the microscope, you can see the protozoa swimming. They are motile, they look like a pear, and they have flagella. The vaginal pH in this case is also greater than 4.5, which is not normal. Treatment of Trichomonas vaginalis include metronidazole for both partners.
Trichomonas vaginalis, portrayed by the Trichomonas on trike attempting a daredevil stunt, is an anaerobic protozoa, the propeller protozoa. It causes the disease trichomoniasis, a sexually transmitted infection of the urogenital tract. Women commonly present with vaginitis, portrayed by the vagina on fire with pruritus, shown by the prairie dog. Women also typically have a characteristic foul-smelling greenish vaginal discharge that is often described as thin and frothy, illustrated by the green discharge from the trike. Some women develop a strawberry cervix, shown by the strawberry, which is an erythematous cervix with punctate areas of exudation caused by capillary dilation from inflammation. This disease can be diagnosed via wet mount prep, which demonstrates a characteristic corkscrew motility, portrayed by the wet slide with corkscrews. Infections are treated and cured by metronidazole, shown by the metronite putting out the flames on the vagina. So in summary, Trichomonas vaginalis is an anaerobic protozoa that causes trichomoniasis. Women present with vaginitis, pruritus, and typically have a foul-smelling greenish discharge. Some women may develop a strawberry cervix. This disease is diagnosed via wet mount prep, which demonstrates a characteristic corkscrew motility. Infections are treated and cured by metronidazole.
Next, we'll talk about candidiasis. This is a fungal infection. What's the name of the fungus? Candida albicans. What does the word alba mean? Alba means white, as in albumin, as in albino, etc. So the discharge here is whitish, usually described as cheese-like, and this is the thrush. How can we diagnose this? We diagnose fungal infections by Wood's lamp. What kind of light are we using? Ultraviolet light. Is it ultraviolet A or ultraviolet B? It's ultraviolet A for the Wood's lamp to diagnose fungus. But ultraviolet B is the one that causes skin cancer. And on KOH mount, you will see pseudohyphae of candidiasis. Treatment is with antifungal medications, such as the ones that end in azole, such as miconazole, fluconazole, clotrimazole, iconazole, etc. There is also nystatin.
Candida albicans, portrayed by the Canadian owl can, is a fungus, shown by the fun guy, that causes opportunistic infections in humans. Growth patterns in culture differ based on ambient temperature. When cultured at 20 degrees Celsius, it grows as yeast and can shift to pseudohyphal growth, portrayed by the sumo growing hyphae from the pot labeled 20 degrees. At 37 degrees, however, the fungus demonstrates germ tube formation, illustrated by the germinating tube at 37 degrees Celsius. This organism is a normal constituent of oral, gut, and vaginal flora, but can overgrow and cause infections, especially in immunocompromised hosts. One common type of candidal infection is pruritic vaginitis, shown by the prairie dog and vagina violet, commonly called a yeast infection. A characteristic white cottage cheese-like discharge will be seen, shown by the cottage cheese. On exam, the vaginal mucosa has a fiery red appearance, shown by the fiery flower petals. There are multiple risk factors for candidal infection. Diabetes is one example, shown by the dyed bead pancreas. Patients taking antibiotics are also at risk, since this disrupts normal bacterial flora, shown by the ABX guy. In immunocompromised states like AIDS, esophageal thrush can be seen, represented by sarcophagus trash with the band aids. In infants, candida overgrowth can cause a diaper rash, shown by the diaper with a rash being examined by the dermatologist. Lastly, this fungus can cause endocarditis, especially in IV drug users, portrayed by the donut heart card with IV drug use. So, in summary, Candida albicans is a fungus that causes opportunistic infections in humans. When cultured at 20 degrees Celsius, it grows as yeast and can shift to pseudohyphal growth. But at 37 degrees, it demonstrates germ tube formation. Candida can cause a pruritic vaginitis, which presents with a white cottage cheese-like discharge and fiery red vaginal mucosa. Risk factors for infection include diabetes and antibiotic use. In immunocompromised states, esophageal thrush can be seen. Other presentations include candidal diaper rash in infants and endocarditis in IV drug users.
Now let's talk about metronidazole, because today we talked about two infections that are treated with metronidazole, and these included Gardnerella vaginalis and Trichomonas vaginosus.
Metronidazole, represented in this picmonic as the metronite, is a commonly used antibiotic medication used to treat anaerobic bacteria and protozoa. This drug exhibits bactericidal activity, illustrated by the bacteria sliders, meaning that it directly kills these organisms rather than just preventing their growth. In the target organisms, metronidazole is taken in through diffusion and is non-enzymatically reduced, forming free radical toxic metabolites, shown as the free oxygen radical metabolites. These toxic free radicals damage the DNA of the targeted organisms, ultimately destroying them, and this is portrayed by the damaged DNA double helix in the image. Common protozoans treated by metronidazole include Giardia lamblia, the jar lamb, Entamoeba histolytica, portrayed as the antennae on the entamoeba, and Trichomonas vaginalis, the trichomonas on the trike. Metronidazole is also used in the treatment of bacterial infections, such as Gardnerella vaginalis, the Gardnerella, and is used to treat anaerobic bacterial infections, the anterobe, particularly infections below the diaphragm. Common side effects of metronidazole use include a metallic taste, portrayed by the metal mouth, as well as a disulfiram-like reaction with alcohol ingestion, represented by the dyed shirt surfer with alcohol bottles, which manifests as symptoms of nausea, vomiting, skin flushing, tachycardia, and shortness of breath. So let's briefly summarize metronidazole. This is an antibacterial and antiprotozoal agent which has bactericidal activity. This drug forms free radical toxic metabolites which damage DNA, killing the organisms exposed. Metronidazole is commonly used against protozoan infections, such as Giardia lamblia, Entamoeba histolytica, and Trichomonas vaginalis. It is also used to treat bacterial infections, such as Gardnerella vaginalis, as well as anaerobic bacterial infections. The side effects seen most often with metronidazole use include the development of a metallic taste in the mouth, as well as a disulfiram-like reaction with alcohol ingestion.
What I like about Picmonic is that they let you review by subject and by system and by using your favorite book. So let's say that you're studying in First Aid 2024 and you are on page, let's say, 100. You can go to Picmonic and click on the First Aid book and go to the page 100 and you'll find all the Picmonics that will help you learn that page. You can create a study plan on Picmonic. You can enter many questions on Picmonic and the questions correspond to the pictures. Here's the methodology that I use to study using Picmonic. I watch the animation, the educational one first, and then the story one. After this, I watch the animation again. I pause and stare at the picture until it sticks in my mind. Then I close my eyes and use my imagination to try to put each part of the picture in its place. Then I open my eyes and review again. I solve the quiz. Then I get a piece of paper and write down the place of the characters. I review the same topic tomorrow, 5 days from now, and 30 days from now. And this will help me retain this topic in my memory for a very long period of time. To this day, I still remember Picmonics that I studied 10 years ago. You can try Picmonic for free. They have mobile apps, whether on Android Store or Apple Store. You can also use it on your tablet or your computer. When you combine visual with audio, with storytelling, with reading the script and spaced repetition and multiple choice questions, you will remember this for a long time. Let's review what we talked about today. We have bacterial vaginosis, Trichomonas vaginalis, and candidiasis. Organism. This is caused by Gardnerella vaginalis, this is caused by Trichomonas vaginalis, and this is caused by Candida albicans. Let's talk about the discharge. It's grayish, whitish, and not itchy here. But the Trichomonas is itchy and greenish. The Candida one is white and cheesy. Diagnosis. Look for the clue cell and use the whiff test to smell. For Trichomonas vaginalis, look for the motile pear-shaped flagellated protozoa. And for the candida, look for the pseudohyphae. Treatment: metronidazole, and here we have an antifungal such as miconazole or nystatin. And more review: vaginitis could be caused by an infection or could be caused by atrophic vaginitis after menopause. Discharge is common and itching is common. We treat with antifungals or antibiotics or antiprotozoals. Estrogen cream for postmenopausal atrophic vaginitis. Abstinence, good hygiene, and if it's recurrent vaginitis, think HIV or any disease of immunodeficiency. Next, we talked about Gardnerella vaginalis, which causes bacterial vaginosis. The vaginal pH is high. Look for the clue cell. It smells like fish, and you treat with metronidazole. For Trichomonas vaginalis, this one is very itchy. The discharge is green. It can lead to strawberry cervix or cervicitis, inflammation in the cervix. Look for the corkscrew motility on saline wet mount, and the treatment is the same, metronidazole. Candida is a fungus. At cold temperature, it gives us the pseudohyphae. At warm temperature, it gives us germ tubes. This one is also itchy, just like Trichomonas, but unlike bacterial vaginosis. Patients who are immunocompromised are at high risk, such as patients with diabetes, chronic antibiotic use, IV drug use, etc. Candida can lead to thrush in the vaginal canal, can lead to oral thrush, and esophageal thrush as well. Metronidazole can kill many bacteria, many parasites, such as protozoa. It damages the DNA of these organisms. We can use metronidazole to treat Giardia lamblia, Gardnerella vaginalis, and Trichomonas vaginalis. We can also use it to eradicate H. pylori. It treats anaerobic infections. Side effects include a metallic taste and disulfiram-like action, so it should not be combined with alcohol. Picmonic has more than 1,800 different picmonics. They covered all of these bacteria, plus fungi, viruses, parasites, and more. And it's not just microbiology. They have picmonics for anatomy, physiology, biochemistry, pathology, psychology, internal medicine, OBGYN, genetics, and more. My favorites are microbiology, pharmacology, genetic diseases, and OBGYN. If you use the link in the description box, you will get a discount. Whether you want to be a doctor, a nurse, physician assistant, nurse practitioner, pharmacist, PT, OT, pre-health, or a paramedic, Picmonic can help you. And don't forget to download the Picmonic app and go to picmonic.com/VIP hookup/medicosis and they will hook you up. Thank you guys for watching. Thank you Picmonic for sponsoring this video. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense. We'll see you in the next Picmonic video.